Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, so you can make use of it. So we will continue with the treatment of nephrotic syndrome. In the last class, we have seen the use of these Mutra Sangrahaniya drugs, Virajiniya drugs and Virajiniya drugs according to the situation. So now the next treatment principle is to maintain the aseptic condition of the urinary tract, because edematous fluid is there all over the body, which is actually acting as a culture media, and the chance of infection is more. So we can use some of the drugs which are antiseptic to the urinary system, like Trina Panchamulakwata, Gokshuradhikwata, Chandraprabhavati or Shweta Parpati, etc. Similarly, another treatment principle is Panchakarma. Now, what are the limitations of Panchakarma, especially when you are using this Panchakarma for children in nephrotic syndrome, minimum change in nephrotic syndrome? Sarvanga Deha Shuddhi is good, definitely, to rule out the disease from the base itself. It is good for immunomodulation. Possible only when the strength of the patient is good and when the patient comes in early stages. If the nephrotic patient comes in the early stages, when he has got sufficient amount of strength remaining, then we can go for Panchakarma treatment. But in a chronic patient or even moderately chronic patient also, the role of Panchakarma is limited and it is difficult to administration also. In the initial stages when the patient comes, we can go for Ksharabasti, which helps to reduce the edema. After emergence of the full-blown picture of the disease, Ksharabasti is not much useful. Rather, Stiradi Yapana Basti or Kukutanda Twak Basti is quite useful. In the later stages, Panchakarma is of no use at all, because we cannot administer the Panchakarma by considering the strength and situation of the patient. Another important line of treatment is the Rasayana treatment or regeneration of the damaged tissue. We know that a lot of tissue has been damaged in the glomerular area, so we have to go for Rasayana treatment. Rasayana treatment, which is very specific to Vrika and the kidney, or Vrika or the kidney, and Medo Vaha Shrotas should be given. So we have got different drugs like Nisha Amalaki Rasayana, Punarnava Rasayana, Pipali Vardhaman Rasayana, then Nagabala Rasayana and Shilajitu Rasayana. Similarly, what cases can be safely treated by Ayurveda? This is very important. The early detected cases can be very safely treated in Ayurveda. Patient is taking steroids on and off for 1 or 2 years. Yes, these cases can be also treated. The patient who has not much developed relapses, yes, they can be also taken. Patient is not taking any other immunosuppressive drugs other than steroids. Okay, limited dose of steroid, moderate dose of steroid with the no any other immunosuppressive drugs like anti-cancer treatment, etc. So anti-malignant drugs, chemotherapy drugs. So that can be treated well. Secondary nephrotic syndrome is very difficult. Secondary nephrotic syndrome is very difficult to treat. Even in the primary nephrotic syndrome also, when there is rapidly proliferative glomerular nephritis, that is also very difficult. And if there is massive development of edema with compromising symptoms like pleural effusion, then pericardial effusion, etc., it is also quite difficult to treat in Ayurveda. So when patient come to Ayurveda, most of the time it is accidentally diagnosed on urine examination. Sometimes patient comes with some allergy with the edematous facial area, etc., and then we go for simple urine investigation. That time we found, yes, patient is having proteinuria, or he took treatment. Most of the time patient comes after taking treatment for a few months and not interested to continue the same. Then they come to Ayurveda. They are fed up of recurrence and this monotonic treatment schedule. Then also patient comes to Ayurveda. They aware of adverse effects of the steroid and thus other immunosuppressive drugs, then also they come to Ayurveda. And few people come with the total trust in Ayurveda. Now, what are the limitations of Ayurveda pediatrician when you are treating minimal change nephrotic syndrome? The cases of nephrotic syndrome which are at the end stage disorders should not be taken. Cases where we are not in a position to withdraw the steroids completely due to risk of relapse and all, that is also safely excluded. Child less than 2 years of age, due to limitations of administration of the medicines and basically it may be because of secondary nephrotic syndrome also, that is also excluded. Chronic cases of steroid resistant nephrotic syndrome, better to avoid. Cases with associated other pathologies of the urinary tract, better to avoid. So sometimes practically we need to start the steroid along with our medication for a shorter period. This is when the patient is taking steroids, we cannot stop it at once, we have to go for the tapering methods. So once we do like this, we start our medications, Ayurveda medications, along with the steroids, and gradually then we will taper the steroids. Another important issue that should be kept in mind is to prevention of a recurrent respiratory tract infection, because one of the most common cause of relapse is URTA, upper respiratory tract infection, maybe viral or sometimes even the streptococcal infections. With each relapse, the disease becomes more and more chronic and exaggerated every time, and every time then you have to go for steroid, and then he becomes steroid dependent. So for an Ayurveda pediatrician, when he is treating nephrotic syndrome, so such type of sudden relapses create much problem, because to reduce the symptoms we have to go for the steroid, that is back again, patient don't want to take the steroids. It is quite difficult even for the counseling the patient and also management. Prevention of recurrent respiratory tract infection is the best way. Therefore, you always keep eye on recurrent respiratory infection and improve the immunity of the child by different methods and take the precautionary method. One of the mainstay of the treatment. So you have to prevent these recurrent respiratory tract infections. You have to educate the patient in this regard. How to treat the steroid adverse effects? The patient comes with a nephrotic syndrome and also there is steroid adverse effects are there. That should be considered as Ojakshaya along with abnormal Medo Vriddhi. So Vojo Vardhaka treatment and other treatment of Atisthaulia should be followed. Guruncha Atarpana, that should be followed. Then improve the Lagu Santarpana treatment should be given. Okay, Lagu, not Guruncha Atarpana. That is for the Saulya patient. And in this case, you have to go for such Vodo Vardhaka treatments, which is Lagu in nature and also Santarpana in nature. Then improve the immunity by different methods. Improve the immunity by different methods. It may be through the Ahara, Vihara, Achara, Satvika Ahara, etc. Initially, when the patient comes, how we will going to start with? Patient comes to Ayurveda with a lot of steroids, diuretics, tonics, and lot of hopes. So first introduce our medicines without stopping any of the medications. Wait for the 15 days, stop the diuretics first. Then after 15 days, reduce the dose of the steroids gradually. Meantime, continue all the Ayurveda medications. Slowly increase the immunity by other methods, by using Ayurveda methods, and stop the steroids by gradually tapering. Decrease the chance of upper respiratory tract infection. Keep check on the repeated respiratory tract infections. Protein supplementation should be continued by different methods. It may be through basti, or it may be orally, or it may be by the intake of the egg albumin, etc. If you are able to decrease the relapse in 1 year, suppose patient is taking 3 relapses in 1 year, after taking Ayurveda medicine, there is only 1 relapse in a year, that is should be also considered as a big achievement. That is also considered to be a big achievement. Okay, so we have to reduce the relapse and recurrence to many cases that we have treated. So we have reduced the recurrence, although we are not able to cure the disease completely. We reduce the incidence of recurrences in a year. Okay, so that helps the patient to become chronic. Prevention of the chronicity. Now there is no swelling, but urine is positive for albumin. So many patient comes like this. There is no swelling, but still when you go for the urine test, it is positive for the albumin or protein. Many patients will have this problem. So check the renal function test and liver function test first. If normal, continue the Ayurvedic treatment with the sufficient protein supplementation. Let the traces of the protein get wasted in the urine and compensate it with the oral supplement if it is traces. But if you can definitely save the patient from steroids and adverse effects, if you do so. Otherwise, you have to go for steroids and other immunosuppressive drugs. The caution is very simple. Caution is this may be a focal glomerular segmental sclerosis, especially in adults, or membranous glomerular nephritis. Patient will have this problem. There is no swelling, but protein is going on. This may be a membranous glomerular nephritis, membranous proliferative glomerular nephritis, rapidly progressive glomerular nephritis. So don't take it granted. Don't take it granted. Frequently check the renal function test. Everything is normal. Still traces are going. Manage this condition just by giving the protein supplementation. Now, this is my prescription in a patient of nephrotic syndrome. In short, I will go for Amapachana treatment. For the Amapachana, I will go for Panchakola, then Agni Tundi Chitrakadya, Aragavardhani, according to the situation. Then Ojo Vyapat Hara treatment, Yashtimadhu Rasayana, Vardhamana Pipali, Nagabala Rasayana, etc. Medo Hara and Mutrala treatment, maybe Chandraprabhavati, Gokshuradivati, Gokshradi Gugulu, Punarnava Gugulu, etc. Udakavaha Shroto Dushti, we go for some of the village drugs, depends upon the severity of the edema. Yakrit Uttejaka drugs are given like Bhumyamalaki, Kumari, Rohitaka, Bringaraja. Rasayana treatment should be given. Rasayana treatment I usually give by means of Chirapaka method like Ashwagandha, Shatavari, Vidarigandha, Bala, Punarnava, Lashuna, Pipali, etc. Ojo Vardhaka treatment has to be followed if there is adverse effects of the steroids. Correction of the mineral deficiency and gastric irritation due to steroids if the patient is taking steroids by using some Abhipatikara, Shankabhasma, Godanti, etc. Protein supplementation should be given either orally by the proteins or egg, albumin, etc. Correction of the food habits, that is psychological treatments. Correction of the food habits, Satvika food should be taken and psychological treatment has to be taken, should be given. Yoga and pranayama also helps and good eating habits. So this is in general my prescription. This prescription is liable to change from patient to patient depending on the surgeon. This is general or superficial line of treatment. What is the take home message? Selection of the patient is very important. Don't take all the patients. Okay. Long-term treatment is required. Prompt medication is required. Prevention of the upper respiratory tract infection is must. Judicious use of the steroids. Frequent urine examination and blood investigations. Check the renal function test in between. Advise the patient to maintain the nephrotic chart and good eating habits. So these are the primary steps that we have to take. So with this we conclude the nephrotic syndrome treatment. Thank you very much.